Hello and namaste. Welcome to our show COVID Corner. My name is Rosina Rai. Today we have invited our special guest. She is Dr. Sangeeta Mishra, Director of Paropakar Maternity and Women's Hospital. And her special area is definitely she is known gynecologist. And it's our immense pleasure to have you, ma'am, on our show. Welcome to the show.
Thank you, Rosina.
Ma'am, there are so many information people are consuming regarding this topic, COVID, and there is different sector is segregated. So there are segregated topics and segregated areas to know. And today we are focusing on more about pregnancy, during pregnancy and a pregnant woman, and in this pandemic. Very first question I would love to ask to you is that what symptoms, this is generally people have these queries, what symptoms are seen in COVID positive pregnant women, and are they any different from the symptoms seen in normal people?
In COVID pregnancy, pregnant patient or the women who are infected with COVID, they don't have any difference of symptom than the general population. So the major symptom of COVID, which I think now everybody knows, is kind of fever, and then you have cough, which may be dry, and then you have muscle ache, body ache, and sometimes you can have difficulty in breathing according to the severity of COVID. So the symptom in pregnant women and the symptom in general people, they are the same.
How should a pregnant woman conduct herself during isolation if she is COVID positive? And another part is there, how can the family members, this is very important matter to discuss, how can the family members support her in such situation?
Now, I would like to say one thing, that pregnancy is a responsibility of the family. It's not only the woman's responsibility. So once a woman is pregnant and if at all she gets COVID, first of all, we should see that whether she has symptoms or if she has no symptoms. If she doesn't have symptoms, so she can isolate herself in a room. It will be good if the room is ventilated, and it will be actually good if the room has an separate toilet and bathroom, because if you have a separate facility, you don't need to mix up with the family. The other thing is you have to take care of your nutrition. So you have to take high protein diet and plenty of liquids, plenty of fluids. You should take green vegetables and fruits. And if you get fever, if you have fever, you can take paracetamol. The paracetamol is not going to affect your baby. So these things should be handy. But again, the role of family member, which you pointed out, is very much important, because family members, they should support the woman, because she is pregnant, and then she has, she's anxious, then she thinks about her baby. So it's the role of the family member that they should provide good food, nutritious food to her, and then they should boost up the morale of the pregnant woman. So at the same time, the role of the family and the role of the woman, I should say role of the society also, it comes into account.
What are the chances of pregnant women experiencing stresses during pregnancy time and anxiety due to COVID? Definitely, this is very serious time they go through, and there is COVID as well as and stress level and anxiety level. Another very linked issues is that how should they cope with such issues?
So anxiety and stress during pregnancy is a common thing, because you are taking care of yourself and then you are taking care of your baby. So actually, whenever a woman is pregnant, certain level of anxiety is always there. But with this pandemic, the women are like much more anxious. They always think that what will happen to the baby if they get infected, the baby will also get infected. So there is more chances of women to take stress, and they are more anxious. So the first thing I would like to say that they should get the correct information, because women are not they are not informed well. So they should know that if even if they are infected, the baby is not going to infect it. So that is the first thing. The other thing, that they should practice SMS. So they have to maintain the social distancing. They should not go into the crowd, or rather, I would say, avoid the crowds, and they should maintain their hand hygiene. So there are certain level of stresses there, because the world is having these new cases, and there are more chances of getting infected. But at the same time, they should not be afraid. So stress is one thing, but getting afraid is another thing.
Well, nowadays the situation has become like this. Very normal headache gives us, huge anxiety, and that myself have experienced. And definitely pregnancy time is, as I said, very serious issue, the condition they go through.
Yeah.
Okay, I was about to ask the family support, how important it is. So you have clarified that family members, I think they are the one have to play a very important role to support her during that time.
Exactly.
As the hospitals are being overwhelmed with COVID patients these days, how safe it is for pregnant women and children to go to hospital for other ailments during such time?
I would like to say that yes, in hospitals, like, people get afraid that hospitals, if you go to the hospital, you get this COVID infection, which is not true. So the thing is, like, even if you go to the hospital, and if you use a mask, if you maintain social distance, if you avoid crowds, you can jolly well take the services. So if you have some pressing issues, like if you have certain emergencies, you should go to the hospital to take services. But if you don't have, major issues which can wait for a while, 1 or 2 days, or if you just have a simple thing which you think it is not that important, you can avoid. But if there is any pressing need, you should go to the hospital. Nowadays, many people ask that whether they should go for the immunization or not, whether they should go for family planning or not.
Yes.
I would suggest that they should go to the hospital, but they should maintain the SMS. That is, again, I would say, masking, hand hygiene, and they should be maintaining the social distancing.
I really do hope that people watching us right now, they are getting the right information, whether they should take treatment, hospital treatments and facility, whether they should visit or not. We have this very big confusion into our mind. Being a doctor and having this long experience and special gynecologist, what do you suggest? What is your guidelines for home isolation, especially for pregnant women?
As I already said, that you should be isolated in a room. So this room should not be shared with other family members. If at all, if you don't have a place in the house, and if at all you have to share a room with a family member, you should always use mask, even at home. Nowadays, people use mask when they go out, but they don't use mask while they are staying at home. So if you are under home isolation, it is very much important that you should use mask. The other thing is, you should wash your hands frequently, or if you cannot wash your hand, you should use an alcohol-based sanitizer. And then you should always use a private toilet. If you don't have a private toilet, you can use the same toilet, but you should flush it more regularly.
I want to ask one question to you. The positive affirmation side is there. What I mean to say is that how really it makes impact on pregnant women, the positive affirmation like exercising, meditation, listening good music. So what do you suggest, being a doctor and being very special person in this sector? So the importance of positive affirmation during this COVID and being pregnant, and especially going through this COVID positive. So what is your opinion on that?
So the most important thing is to stay positive. And now staying positive means different things for different women. So some women, while they are listening to the music, or once like they can just walk in the room, or they can listen to some positive talks that makes them very comfortable. There are certain women who like to read some religious books. So it is whatever way you feel that you're relaxed, whatever makes you relaxed, because you are confined to a room, because you are COVID positive and you are confined to a room. So basically you should do whatever activity is de-stressing you. By de-stressing, it means different things to different people. So you can have light exercises, and then you can do some type of yoga, then you can do some kind of meditation, then music, reading books, and so many other things which you would like to do. Like some people have a habit, or it's not a habit, but have a hobby of painting, so they can take up painting. And if you are playing some kind of music instrument, you can do that musical instrument. So it's just the way you remain positive, it's up to you.
Basically, you mean to say that it really makes impact on. So positive affirmation, if you go through that, definitely it will create positive impact on you and baby itself.
Yeah, exactly. It's a well-established fact that everybody should remain positive during pregnancy. Even in Hindu mythology, it is said that whatever, you should chant those mantras, and then you should read those slokas so that your baby is listening to them. It's in the mythologies as well. So yes, she should be very positive.
Especially in this pandemic, it is very, very fruitful.
Yeah.
There is two kind of opinion regarding vaccination, getting vaccinated. Some say pregnant women should take COVID vaccine, and another part is there, another explanation is there, they should not. What actually is the case, ma'am?
So initially, when the vaccination started, it was said that pregnant women should not take COVID vaccination. But now the recent guidelines from other countries, like RCOG guidelines from UK, it is saying that pregnant women can also take vaccination. So they did actually, it was not a study, but there were some thousand of women who took these COVID vaccination during their pregnancy, or they just got pregnant soon after taking this vaccination. And in those women, there have not been any reported negative impact on the pregnancy. So the recent recommendation is that if a pregnant woman wants to take a vaccine, she should take a vaccine, preferably in the second trimester. So they say that if at all you have to take a vaccine, you can omit the first 3 months and the last 3 months. So in between the middle 3 to 6 months, you can take the vaccine.
So what is the case after post-COVID positive result? If a pregnant woman, she has a COVID positive result post situation, vaccination, what is the situation after that? They should get the vaccine. They are pregnant already and they are COVID positive, right?
So if you are COVID positive, there is no need to take vaccine. But once you have crossed that duration. So now what government is saying, that if you have COVID infection and if you are past 1 month COVID infection or 2 months past COVID infection, you can take COVID vaccination. But actually being a COVID positive is itself, it's a type of vaccination, I should say. That is kind of natural vaccination, because you have gained immunity from that disease. So it depends on the choice of the woman and the recent guidelines of the government.
Another very big topic we want to have conversation with you is that breastfeeding. Is it okay to breastfeed? if the mother has taken COVID vaccine before childbirth?
Very interesting question. Actually, breastfeeding is recommended even if you are COVID infected. Means like if you have infection, you can breastfeed your baby. If you have taken vaccination, you can breastfeed your baby. And if a mother is very sick, like if she is diseased and she has some problem and she cannot, breastfeed the baby, we always recommend that mother should express the breast milk and feed the baby. So in any condition, you have to breastfeed the baby. But again, I would repeat, you have to wash your hand before feeding the baby. You should always use a mask before feeding the baby.
Many of us are very confused in a confusing line. Some say COVID vaccine increase the risk of miscarriages. What does the evidence says?
It's a myth. It's a myth.
It's a myth.
Yeah. So there are no evidence that taking a COVID, vaccine can cause miscarriage or abortions. So it is quite safe, and a woman, if she wants, she can take a COVID vaccination.
Thank you so much, Dr. Sangeeta Mishra, for this wonderful information. And I really do hope that people watching us are going to get now clear idea and information about this pregnancy and symptoms and so many things we already have discussed. Thank you so much once again for your wonderful information to the people.
Thank you, Rosina, for giving me this opportunity. Thank you so much.
Thank you so much. For today, I want to take a leave. And definitely in next episode, we are going to have another wonderful guest. Till then, I take a leave. Thank you.